not in the middle of a national crisis. Things are deteriorating. So my name's Dr. Julia Patterson, and I run a campaigning organisation called EveryDoctor. And we're a group of doctors and members of the public who are fighting for the future of the NHS. There's a huge concern at the moment about where the government is choosing to place their money. Obviously the NHS is funded by the public, and you would hope that all of the money that goes into the NHS is to support the services, to support the staff, and to ensure the sustainability of the organisation. But what's been happening in recent years is that essential repairs haven't been done. There haven't been enough in the way of what's called capital investments into the NHS, which means that there's a lot of problems with buildings crumbling. In the last few weeks, we've even heard about sewage that's been ending up on wards, A&E departments, maternity wards over the last year. There's also a concern about staff shortages. We're missing almost 10% of the entire workforce in the NHS in England at the moment. And as we emerge from the major waves of the pandemic, the government had an opportunity to tackle a lot of the root sort of problems within the NHS. Instead, we're seeing a huge amount of money being spent on consultancy, so external firms who are giving advice about how the NHS should be managed. There's private healthcare being involved in the NHS in a way that's really concerning, and some of that isn't transparent. There was an announcement maybe about 6 weeks ago now about £1 billion that was going to be put into the NHS to tackle some of the problems, and yet the things that were being suggested, like for example more ambulances, need to be staffed. And our concern, I guess, is where are these staff coming from? Because we know that the NHS can't staff more ambulances. If it was as simple as that, we wouldn't be in the situation we are. And so who is staffing the ambulances, and where are the ambulances coming from? So we've asked some questions of Rishi Sunak, and we're yet to hear back. The NHS is an institution which is supposed to be there for patients. It's supposed to be there in the long term, and the more money that's funneled into private companies, often who are coming in and providing short-term solutions for the NHS, doesn't increase the sustainability in the NHS. It's not going to fix the problems we're facing. I think there's this myth that we can't afford the NHS, and I think we need to flip that narrative and start thinking about the value that it provides our society, because the value of the NHS goes far beyond an individual's health. If communities are healthier, they're more productive, our economy does better. There's huge benefits for our country if people are healthier. So we need to think about it in those types of terms. But also, the government don't have a mandate to be underfunding the NHS. When the public have been polled about what they think about the NHS, if they wanted to continue, and what they think about its principles, which is of equal care, care for all, care which is free at the point of delivery, the public have consistently shown that they support those ideas. And so, to my mind, the government has two options. They either need to poll the public and ask if they, want the NHS to continue along those three principles, or they need to be making radical changes to make the NHS a service which fulfills the promise it offers to the public, because at the moment it's not fulfilling that promise. Too many people are falling between the cracks, and what's awful is that a two-tier healthcare system is developing in our country, and a lot of vulnerable people are missing out and not getting what they need. It all stems from the idea that the NHS has, had privatisation infiltrating for a really long time. A lot of NHS campaigners' concerns is that the staff are being intentionally treated badly and underpaid, because what that does to a system is it destabilises it, and it actually allows it to be more easily privatised, because it's more palatable to the public now that private companies become involved, because a lot of people are desperate. A lot of people can't access the healthcare they need. I hear from doctors often who are telling me, I know what I should be delivering to my patient, but I can't deliver that. There's no way for me to deliver this care safely, and that's horrifying. And this isn't a short-term situation. Like, we're not in the middle of a national crisis that's going to be short-lived and then we'll move out of it, and we can explain things away for that reason. Things are deteriorating, and so it's difficult to know how this is going to change if the politicians don't sit up and start listening to the experts. That's something they're not doing. openDemocracy's work on this has been so important, because it has not had the attention it should have done in terms of private healthcare companies. But if we're going to create some kind of proper, meaningful, long-term NHS recovery task force, then the government are going to have to start listening to frontline staff, and they're going to have to listen to experts as well. Instead, they're throwing money at consultancy firms and they're funneling money into private companies. And it's no way to go. More and more people are becoming aware of what's happening, and they're speaking up, and they're becoming interested, involved and active in campaigning for the NHS, and that is an incredibly good thing. I've been doing this for about 7 years now, and the conversations I have with the public are very different now than they were 7 years ago. It's actually really hopeful to see that happening, because it's only when that public awareness reaches a tipping point that we can hope that things are going to change. But I feel like something is changing right now in our society. People are feeling let down for a lot of reasons, and the NHS is one of the core reasons people feel let down. And I think that pushback is beginning now. So hopefully, hopefully we'll change things together.
Yeah.